What if I told you that most strokes don't just happen out of nowhere? What if I told you that your body sends out warning signals, sometimes a full 24 hours in advance, and that millions of people miss them every single year, not because they weren't paying attention, but because nobody ever taught them what to look for? Right now, someone in the United States suffers a stroke every 40 seconds, and for people over 50, the risk doesn't just increase, it accelerates. Stroke is the number 5 cause of death in America and the leading cause of long-term disability in adults. But here is the part that keeps me up at night. Up to 80% of strokes are preventable. And yet, the death and disability rates remain devastating. Why? Because the medical system has done a poor job teaching people about the window that exists, that narrow critical window, the day before a stroke hits. There are signs, there are symptoms, there are biological red flags that your body is waving frantically, trying to get your attention. And most people, most doctors even, dismiss them. They chalk it up to fatigue, to stress, to getting older. I've had patients sit in my office and describe symptoms that, in hindsight, were textbook pre-stroke warnings. And they had been to 2 or 3 other physicians before me who told them they were fine. They were not fine. I'm talking about things like a sudden strange headache that doesn't feel like any headache you've had before, a fleeting moment where one side of your face felt slightly numb, a few seconds, maybe 30, where you couldn't quite find the word you were looking for. These aren't signs of aging. These are your brain sending out an emergency distress signal. The medical term for what many of these patients are experiencing is a TIA, a transient ischemic attack. Some call it a mini stroke, but that word mini is dangerously misleading. A TIA is not small, it is a major warning. Studies show that nearly 1 in 5 people who have a TIA will go on to have a full-blown stroke within 90 days, and the highest risk window is the first 48 hours. In this video, I'm going to walk you through what a stroke actually looks like the day before it strikes. I'm going to show you the biological chain of events happening inside your brain and your arteries. I'm going to share real patient stories from my clinical practice. And I'm going to give you a clear, actionable protocol that could, and I say this with complete medical sincerity, save your life or the life of someone you love. By the end of this video, you will understand exactly what warning signs to look for, why conventional medicine misses them so often, and what you can do starting tonight to dramatically reduce your stroke risk. Stay with me. This is information your life may depend on. My name is Dr. Ryan Montel, and I've been practicing medicine for over 15 years. I trained in internal medicine and later specialized in cerebrovascular health and surgical neurology. Over the course of my career, I've treated thousands of patients, many of whom came to me after surviving strokes that could have been prevented. Before I go any further, I want to connect with you, the person watching this right now. I'd love for you to drop a comment below and tell me, how old are you and where are you watching from? Whether you're 54 years old in Florida, 71 in Texas, or watching from somewhere outside the United States, I want to know. This community is built on real people sharing real experiences, and your comment genuinely helps this video reach other seniors who need this information. And if you are new here, welcome. I'd be honored if you subscribe to this channel. It's completely free, and every video I publish is designed to give you the kind of medical knowledge that most people only get if they have a doctor in the family. Hit that subscribe button and leave a like on this video. It takes 2 seconds, and it helps this information reach thousands of other people over 50 who deserve to know it. Now, back to what I see every day in my practice. The traditional medical system is extraordinarily good at responding to strokes after they happen. Emergency protocols, clot-busting drugs, surgical interventions. These have saved countless lives. But the system has a significant blind spot. Prevention in the hours and days before a stroke. Here's why that blind spot exists. Stroke prevention is not profitable in the conventional sense. There are no blockbuster drugs you take for one day to prevent a stroke. Prevention requires education, lifestyle modification, and vigilance. And those things don't generate billions in pharmaceutical revenue, so they get deprioritized. The statistics are sobering. According to the CDC, approximately 795,000 Americans suffer a stroke each year. Of those, around 185,000 are recurrent strokes, meaning someone who already had one. The annual cost of stroke-related healthcare in the United States exceeds $46 billion, and yet, large-scale studies consistently show that public awareness of stroke warning signs remains dangerously low, particularly among adults over 55. A 2021 study published in the journal Stroke found that less than 38% of adults could correctly identify all 5 major stroke warning signs. Think about that. Less than 4 in 10 people. The warning signs that could give someone the extra hours they need to call for help and potentially avoid catastrophic brain damage. In my clinical experience, the most missed category is what I call the day before symptoms, the subtle, easy-to-dismiss neurological signals that precede a major stroke event by 12 to 24 hours. These are not the dramatic Hollywood version of a stroke. There's no sudden collapse, no instant loss of speech. These are quiet, fleeting, and deceptively easy to rationalize away. That is exactly what we're going to address today. Because the more you understand the mechanism behind a stroke, the actual biology of what is happening, the better equipped you are to recognize these signs when they appear. To understand what a stroke looks like the day before it happens, you need to understand what a stroke actually is at the biological level. And I promise you, I'm going to make this as clear and simple as possible, because this is the part that changes how people see their own health. Think of your brain as the most demanding city in your body. It needs a constant, uninterrupted supply of oxygen and glucose to keep functioning. That supply comes through a network of arteries, highways that carry blood directly to brain tissue. Now, what happens when one of those highways gets blocked? Brain cells, neurons, begin to die within minutes. In fact, for every minute a stroke goes untreated, approximately 1.9 million neurons are lost. That's not a metaphor. That's what the research tells us. Time is brain, as we say in medicine. But here's the part most people don't know. The highway doesn't usually get blocked all at once. In the majority of ischemic strokes, which account for about 87% of all strokes, the process begins with a slow, progressive narrowing of the arterial walls. This is called atherosclerosis. Fatty plaques build up inside the artery walls over years, decades. And then, something triggers the final event. A small piece of that plaque breaks off, or a blood clot forms in the heart, most commonly in patients with atrial fibrillation, and travels to the brain. Once it lodges in a cerebral artery, blood flow downstream is cut off. Neurons begin to die. Depending on which artery is blocked and for how long, the damage can range from mild cognitive effects to complete paralysis, loss of speech, or death. Now, here is where the day before story begins. In many cases, before that final blockage, there are warning events. The artery may briefly, partially occlude, block, and then clear itself. Blood flow is temporarily reduced. The downstream neurons begin to struggle, and your brain sends out signals. Those signals are symptoms. This is the TIA, the transient ischemic attack. The blood flow interruption resolves on its own, sometimes within minutes, sometimes within hours. The symptoms disappear. The person thinks, well, that was strange, but I feel fine now, and they go on with their day. But the plaque is still there. The artery is still narrowed. The blood clot that partially blocked and then dislodged may still be circulating. And within 24 to 48 hours, in a significant percentage of cases, the final, complete blockage occurs. I use this analogy with my patients. Imagine a garden hose with a kink in it. Water still flows through, but not as well. Occasionally, the kink tightens and the water stops entirely. Then, it relaxes. You might not notice the problem right away, but eventually, the hose crimps completely. That's your artery. That's your brain. And that's why the day before matters so much. I want to tell you about a patient of mine named Gerald. Gerald was 67 years old, a retired school principal from Ohio, a man who prided himself on staying active and eating reasonably well. He came to me not because he thought something was seriously wrong, but because his wife, Louise, had insisted. 2 days before he sat in my office, Gerald had experienced something he described as the weirdest thing. He was reading the morning newspaper when, for about 30 seconds, he couldn't understand what he was reading. The words were there. He could see them, but they made no sense. And then, just like that, the moment passed. He shook his head, poured himself another cup of coffee, and went about his day. That evening, while washing dishes, he noticed that his right hand felt different. Not painful, not paralyzed, just slightly clumsy, like it didn't quite belong to him. He dropped a glass. He assumed it was fatigue. He went to bed. The next morning, he woke up with what he called a pressure headache. Not a pounding migraine, but a deep, unfamiliar pressure in the back of his head. His wife noticed that when he smiled at her across the breakfast table, one corner of his mouth seemed lower than the other. That's when she called my office. When Gerald walked in, his vitals were elevated. His blood pressure was 178/104. A rapid neurological assessment showed subtle but measurable weakness in his right-hand grip, about 30% below normal for his age. His MRI with diffusion-weighted imaging revealed something that confirmed my suspicion: a small area of restricted diffusion in the left hemisphere. A TIA had occurred. His left middle cerebral artery showed significant stenosis, narrowing, of approximately 72%. Gerald had not had a stroke yet, but he was hours away from one. We admitted him immediately. He was placed on antiplatelet therapy. His blood pressure was carefully managed, and within 24 hours, he underwent a minimally invasive procedure to address the stenosis. I also worked with him on an immediate dietary protocol to reduce further plaque inflammation. Gerald went home 4 days later. No stroke, no disability, full cognitive function. When I saw him at his 6-week follow-up, he grabbed my hand and said, "Dr. Montel, my wife saved my life by paying attention." And I told him, Louise noticed the signs because she knew what to look for. That's what made the difference. Gerald's story is not unusual. It's a version of what I see in my practice regularly. The difference between his outcome and the devastating outcome that could have followed is a matter of recognition, recognizing the warning signs in that critical window. And that is exactly what I want to give you today. Now, I want to talk about the mistakes, because in my 15 years of practice, I've seen the same patterns repeated over and over, and these patterns cost people their health, their independence, and sometimes their lives. I'm not sharing these to make you feel bad. I'm sharing them so you can recognize them and stop making them. Mistake number 1, dismissing transient symptoms because they go away. This is the most dangerous mistake of all, and it's completely understandable. If a symptom resolves itself, if the arm weakness disappears in 5 minutes, if the confusion clears up in 30 seconds, the natural human response is relief. It passed. I'm fine. But as I explained in the biology section, a TIA resolving does not mean the problem is gone. The artery is still compromised. The plaque is still there. The risk is still active. In fact, the resolution of a TIA is the single biggest window of opportunity for intervention, and most people miss it entirely. Mistake number 2, attributing neurological symptoms to aging. I'm just getting older. I hear this at least 3 times a week. And while it's true that certain cognitive changes are part of normal aging, there is a clear and important line between normal aging and neurological distress signals. Forgetting where you put your keys is normal. Suddenly being unable to understand a sentence you're reading for 30 seconds is not. Feeling tired after a long day is normal. Waking up with a deep, unfamiliar pressure headache that doesn't respond to your usual remedies is not. The mistake is applying the same excuse to both categories. Mistake number 3, taking aspirin and waiting. Many patients, when they experience worrying symptoms, take a couple of aspirin and go to bed thinking they've handled it. Now, Aspirin does have a role in some stroke scenarios, but self-medicating with aspirin and waiting is not a protocol. It can actually be harmful if the event is a hemorrhagic stroke rather than an ischemic one, because aspirin increases bleeding risk. More importantly, it gives people a false sense of security. They feel like they've done something. They haven't. The right action is to call a medical professional or go to an emergency room. Mistake number 4. Ignoring high blood pressure. Because it's always been high. Chronically elevated blood pressure is one of the single most powerful risk factors for stroke, and yet I regularly see patients who have been living with blood pressure above 140 over 90 for years, sometimes decades, who have normalized it. Oh, that's just how my blood pressure is. No. Hypertension damages arterial walls over time, accelerating atherosclerosis, making stroke dramatically more likely. If your blood pressure is consistently above 130 over 80, that requires active management, not acceptance. So what do you actually do? What is the actionable, practical response to everything I've shared? In my practice, I've developed what I call the SAFE 24 protocol, a 4-step framework designed specifically for adults over 50 who want to recognize pre-stroke warning signs and respond appropriately within the critical 24-hour window. SAFE stands for symptoms, assessment, fast action, and environment. Let me walk you through each step. Step 1. Symptoms. Learn the full pre-stroke warning list. Most people know the FAST acronym: face drooping, arm weakness, speech difficulty, time to call 911. That's good, but it's incomplete. In the 24 hours before a stroke, symptoms may be subtler. Add these to your awareness list. Sudden, unfamiliar headache unlike previous headaches, particularly at the back of the head. Brief confusion or inability to understand words or sentences. Sudden vision changes, including blurring or loss of vision in one eye. Unexplained dizziness or loss of balance that doesn't respond to sitting down, and unusual sensory changes, numbness, tingling, or heaviness on one side of the body, even if brief. Write these down. Put them somewhere visible. Share them with people who live with you. Step 2. Assessment. The 60-second neurological self-check. If you or someone near you experiences any of the above, do this immediately. First, ask them to smile. Check for facial symmetry. Second, ask them to raise both arms to shoulder height and hold them there for 10 seconds. Watch for drift on one side. Third, ask them to repeat a simple sentence. Listen for slurred or confused speech. Fourth, ask them what day it is and where they are. Note any confusion. This takes 60 seconds. If any of these checks reveal abnormality, even mild or brief, that is a medical emergency. Time matters. Step 3. Fast action. The 911 rule. No exceptions. If the 60-second assessment reveals any abnormality, call 911. Do not drive to the hospital yourself. Do not wait to see if it gets better. Do not call a family member first. Call 911. Paramedics can begin assessment and treatment during transport. They can pre-alert the hospital's stroke team. This can reduce time to treatment by over 40 minutes compared to self-transport. And in stroke medicine, 40 minutes can be the difference between full recovery and permanent disability. Step 4. Environment. Daily habits that reduce your risk window. Prevention is also part of the protocol. 3 specific habits have the strongest evidence for reducing pre-stroke risk in adults over 50. First, blood pressure monitoring at home. Check it at the same time each morning before eating. Record the results and share them with your physician. Second, hydration. Dehydration thickens the blood and increases clotting risk. Aim for 6 to 8 glasses of water per day. Third, omega-3 fatty acid intake. Consistent evidence supports that EPA and DHA reduce arterial inflammation and platelet aggregation. Discuss supplementation with your doctor. The SAFE 24 protocol is not a replacement for medical care. It is the bridge between awareness and action. and that bridge saves lives. One of the most common questions I receive from patients is, Dr. Montel, if I start doing these things, if I learn the signs, implement the protocol, make the lifestyle changes, how long before I see a difference? It's a fair question, and the honest answer is faster than you might think. Let me walk you through a realistic timeline based on what I've seen in clinical practice. Week 1. Awareness shift. In the first week, the most important transformation is cognitive. You now know what to look for. You've shared the warning signs with the people around you. You've started monitoring your blood pressure in the morning. You may not see measurable physiological changes yet, but your risk response time has already improved dramatically. Studies show that people who are educated about stroke warning signs call for help an average of 47 minutes faster than those who are not. In stroke medicine, that 47 minutes translates to approximately 89 million saved neurons. Weeks 2 to 4. Physiological response. If you've begun hydrating consistently, your blood viscosity, blood thickness, begins to normalize within 5 to 7 days. If you've added omega-3 supplementation as discussed with your doctor, early anti-inflammatory effects on arterial walls become measurable at approximately the 3-week mark. Blood pressure, if you're monitoring consistently and have begun reducing sodium intake, often shows a meaningful downward trend within 2 to 4 weeks. Month 2 to 3. Risk reduction becomes measurable. By the 2 to 3 month mark, if you've made consistent adjustments, blood pressure management, hydration, dietary anti-inflammatory measures, your overall cardiovascular risk profile begins to shift. This is when your physician may be able to note improvement in your readings and potentially reassess your medication needs, though never adjust medications without medical guidance. I want to share a second patient story. Her name is Dolores, 71 years old, a retired nurse from Georgia. She came to me 6 months after a TIA that had been dismissed by her previous physician as anxiety. By the time she reached my practice, she had experienced 2 more TIA events. She was, statistically, at very high stroke risk. Dolores was sharp. She was motivated. We implemented the full SAFE 24 approach, combined with a physician-supervised medication adjustment. Within 8 weeks, her blood pressure had dropped from an average of 162/98 to 131/82. Her follow-up Doppler imaging showed improved blood flow in her carotid arteries. 14 months later, Dolores has had no further TIA events and no stroke. Results like Dolores's are not guaranteed, but they are possible, and they begin with awareness. We've covered a tremendous amount of ground today. Let me give you the 5 most important takeaways from everything we've discussed. 1. Strokes have a warning window. Up to 80% of strokes are preventable, and many are preceded by TIA events that appear up to 24 hours before the full stroke. These warnings must never be dismissed. 2. Know the extended warning signs. Beyond the classic FAST acronym, watch for unfamiliar headaches, sudden confusion, brief vision changes, unexplained dizziness, and one-sided sensory changes, even if they last only seconds. 3. Use the 60-second self-check. Smile symmetry, arm hold, speech clarity, and orientation. These 4 checks take 1 minute and can identify a neurological emergency in real time. 4. Call 911 without hesitation. Self-transport delays treatment by an average of 40 minutes. That delay costs brain tissue. Make the call. 5. Daily habits compound into protection. Blood pressure monitoring, hydration, and omega-3 fatty acids, applied consistently, produce measurable risk reduction within weeks. Here is your 1 action for tonight. Write down the 7 pre-stroke warning signs on a piece of paper. Put that paper on your refrigerator. Text or call one person in your life, a spouse, a sibling, a friend, and tell them what you learned today. That conversation could be the most important one you have this year. And finally, I want you to comment 1 word below this video. Protected. Just that word. It tells me you watched this to the end. It tells YouTube's algorithm to show this to more seniors who need this information, and it puts you in a community of people who are taking their health seriously. Type protected in the comments right now. I went into medicine because I believe every person deserves access to the kind of information that changes outcomes. You've given me your time today, and I don't take that lightly. Take care of yourself. Share what you've learned. And remember, knowledge, acted upon, is the most powerful medicine there is.